as people are increasingly experiencing the conventional healthcare system that's failing them, it's not helping to improve their health or make them feel better or have more energy. They're turning to concierge medicine and more personalized approaches. More and more doctors are also getting into this business model because they're frustrated by the constraints the insurance companies placing on them. They're not allowed to put the patient first, but are only recommending treatments or tests that will be reimbursed by the insurance company. And so they're burnt out. They want more job satisfaction too, because they got into this to help people. This new model that's emerged and is gaining in popularity, this concierge model, enhances not only the job satisfaction for physicians and enables them to prioritize patients' needs, but patients also are flocking to this because they're finally getting the help they weren't getting. Susan Greeley is Senior Vice President and National Director of Wellness Programming at Castle Connolly Private Health Partners. And today she is going to talk to us all about concierge medicine and what they're doing. Thank you for
Hi,
being here.
Tom. Thank you. Thank you for having me. I'm excited to be here.
So a little backstory. Susan, you had me on your podcast talking about bone health and osteoporosis. And then you and I were at probably one of the biggest conventions or conferences in the country, IHS in New York earlier this year. And I remember coming up an elevator and there you were. You're just standing there with a couple friends.
And I said, and it was almost as if it was destined at that moment. And we had never met in person.
That's
And
right.
hey,
That was great. So
yeah.
then we got talking, and I really learned more about what you were doing, and I'm excited to have you on and share more of that. So tell people a little bit about yourself and why you're doing what you're doing.
Okay, I'd love to. Thank you again. And yes, thank you for being on a Sense of Wellness podcast. That is my podcast that I do through Castle Connolly Private Health Partners, focused on sleep, exercise, nutrition, and stress management. So our episode on osteoporosis is one of the most popular and most downloaded. That said, it's part of what I get to do in my role, and I am thrilled to educate listeners a little bit more about the concierge model and then more specifically what I do in the world of wellness. I say I work on integrating medicine and wellness in a very actionable way. So we partner with physicians, John, and help them convert their traditional practice. It isn't always primary care, but often they are primary care physicians who then are become burned out. They're looking for a different way to practice. You hit the nail on the head when you said they got into medicine to help people, to treat people, to work on making people healthier, and yet they find themselves in our healthcare system these days completely burned out, not able to practice the way they wanted to. So in any case, we partner with physicians. I help them along that way with when they are converting their practice to a new way, which is this membership model. It enables them to spend more time, true quality time with all of their patients. And that's the key. It is ultimately about patients, which could be you and I are patients at some point, right? We all are.
We all are, yeah.
And yeah, we deserve that time with our physician, and the physicians also deserve to be healthy and happy and doing what they love. So it really is, I believe, the way to practice, right? To the way to practice medicine these days. It's creates exceptional care. So where I then step in once they are in this new model is collaborating with them to help be that extension of their care. I run a team of health coaches, John, and our company offers unlimited health coaching to our members. And think about that. That's tremendous. So the doctors still spend an increased amount of time, but what does a health coach do? We take actionable behaviors we take data. It could be their weight and body fat, it could be their blood sugar, cholesterol levels, you name it. We take some of their health metrics and data and work with them to come up with a non-prescriptive and personalized plan to also support their health. It could be working on prevention, and it could be managing chronic disease. So we have tremendous outcomes and improvements in people's health simply by giving them that ongoing support. And that's a key aspect to healthcare.
It's amazing to me. You said you merge or marry, I don't remember the exact words you use, wellness and medicine. And that to me is a shocking damnation of our current medical system because, in my mind, there is no difference. Wellness is medicine, and medicine is wellness. They are inextricably linked. And just like with your sense programs, sleep, exercise, nutrition, and stress, and when you're looking at these markers that you just mentioned, like blood sugar, cholesterol, exercise, nutrition, that is medicine that improves all of those the parameters and variables you just talked about, increases health span and longevity by doing those activities. And the fact that our medical system sees those, talks about them as different things, and it's not medicine, it's wellness, just to me demonstrates how broken our system is.
I completely agree with you. It's ironic that we're saying it in that sense. And we have to work to bring them back, to marry them. Why is it a disparate world? I don't understand that either because we're human beings. We need to take that holistic approach. You and I, as we said, we were at this conference that does focus on functional, integrative and functional medicine. But why did we ever get to that point? Truly is my question.
Yeah.
Right. So bring it back to sleep, exercise, nutrition, and stress management that I love to talk about. These are actionable pillars of wellness. There's a lot more to wellness that we can talk about and longevity. If you follow the blue zones, you can bring in other aspects that create that well-being. But just like talking about these four pillars with your physician is so important. How can you go to your doctor and get medication for something if they don't understand other aspects of your life? I just was talking to one of our members this morning who found out that her hemoglobin A1C, which is a measure of your blood sugar over a 3-month time frame, it had gone from a normal 5.6 up to 6.3, and she was horrified.
Wow.
And, we dove into very specific aspects of her daily life and found out that it was a small change that she had added a little dessert every night. She didn't realize it would have that dramatic of an effect and other reasons too. But sometimes yeah, you have to
I,
dive into the lifestyle.
I love that story because at the footer, I don't know if you and I have emailed a little bit. At the footer of all of my emails, my signature is, small changes done consistently can change the trajectory of your life. And that's a great example because that just one negative small change was putting her on the path to diabetes.
Correct.
And similarly, just
Yes.
by limiting that one thing, just
Mhm.
that consistency, and just it doesn't have to be, change your entire life overnight, which is, I think, gets people feeling so overwhelmed. And when they have people who are partners with them, the health coaches that you talk about, the programming that you talk about, it allows people to have the resources, have somebody to, if nothing else, commiserate with, just have that connection with, but then also have the education, the resources, and the recommendations.
That's exactly it. That's what we do. You hit that. I love that you get it. You get what we do and you see the value in that. And it is a huge differentiator. It is tremendous value. Those small, consistent changes make a big difference. So you and I can't say it enough. And the proof is in the pudding, John, isn't it? When we help, it's not even obvious to the person sometimes until you have that discussion about, well, this is what I'm doing. Oh, and I didn't even realize, believe it or not. Or I changed my activity because I just moved and I'm in a new home, or I got a different job and now I'm not walking 40 blocks every day. I'm just going 2 blocks. Or, the pandemic changed people's physical activity dramatically, as we know, right? They
Right.
were much more active than all of a sudden they were home. So in any case, it's until you dive into that and that one-on-one relationship with the coach makes a difference. So back to our model, this is unique in that we are creating this trusted environment, and our physicians, our concierge physicians, really see that health coach as the partner too, in that extension of their care, because they're doing the medicine. They don't have time and they don't necessarily need to. It's important for the physician to say, I think that you could take a look at your diet and yeah, I would love for you to lose weight, lose some body fat. I'm testing your body fat now through, the use of an in-body, for example. So take that. That's what we're pushing towards to get doctors to get away from just a weight on a scale. Let's look deeper. Come on, we have this information. Look at their lean body mass, look at their muscle, their percent body fat and water. And then we can take that data and really make it even more hone it and make it very specific to that person. We're not just on a GLP-1 to lose weight. That's completely missing the mark, isn't it? And it's a disservice. We need to help them lose specific, maybe visceral body fat is really high, or maybe we assumed their visceral body fat was high, but it's not so bad. I could talk about, those specifics for a long time, but what I love and get excited about is the future of medicine in those exact ways where we're taking data and technology and making it very personalized, but we don't lose sight of the personalization.
Let me ask you in big sort of broad picture, broad strokes, how would you characterize the difference in terms of how the model is organized and what the patient would experience between the difference between the conventional insurance-based model healthcare visit that we all know about and a concierge model like yours?
The biggest, biggest differentiator is the communication, the level of communication, the frequency, the perhaps intensity. I don't know how to describe that, but that's really key. I don't know if you've had this experience where you call your physician, primary care. I've had this. A call, nobody answers the phone. And it's shocking to me that during normal business hours, I can't even get somebody to answer the phone.
Well, or it takes 2, 3, 4 days to get an answer back.
But to get that was the next
Yeah, it's
aspect.
frustrating.
Right. And in this model, this membership model, the concierge model, it's almost instantaneous. I can't speak for every physician. Obviously, they still, if they're with a patient, they can't answer somebody else in that moment. But I can assure you they're answering, you know, that day at a minimum. And we offer same or next day appointments. You can't put a value on that, in my opinion. The more I see this, I've been in this area for about 6.5 years now, John, and during that time, even my own understanding and experience has changed when you see so many different examples of how effective, how you're actually thwarting emergency room visits. I've
Right.
Yeah, I've seen that frequently when you wake up in the morning, your blood pressure's super high, and you can message your doctor right then and say, I don't know what's happening, but my blood pressure's really high. What do I do? A lot of people would zip to the ER. Well, in this scenario, they don't. They get the doctor to get on the phone, calm them down, and triage that on the phone. But you can't get that in the traditional model.
So a concierge model is a membership model, is that right?
Correct.
So
Yes.
and this is not unique to what you guys do. That's the overall model called concierge medicine that everybody is doing concierge services and around the country. It's essentially a membership model where people pay a monthly, yearly, I don't know, the duration, a fee, and for that they get more high touch medicine. Tell me if I'm
Right.
mischaracterizing anything. Better communication. They're getting doctors who are perhaps doing more integrative and functional nutritional medicine as well, instead of just prescribing medications. It's more personalized
Right.
care. But how does somebody, if they're looking to find that type of care,
Mhm.
because it is superior care, how do they vet? How does somebody vet, one concierge doctor or one concierge company from any other? Because as far as I know, there's no national like board certification, and I'm a concierge and doc.
That's a great point. Maybe someday we'll get there, and I don't think that's a bad idea. Because, why are you getting into it? typically it's because you want to practice better. You want to have extended visits with your patient. You want to make a difference in their lives, of course, with the preventative side and management of care, and not just punt them down the field, that I like to say. I was kind of laughing about that because you see it. They have so little time in a traditional model that there's a whole lot of that going on. And we have to be honest about that, that they take the 2 minutes, and if they can, as I said, punt it down the field, they sometimes have to and do. So, that said, we spend a lot of time, it's this relationship building and it's getting to know them. So, a little history about Castle Connolly Private Health Partners before CCPHP existed. Uh, our founder had created Castle Connolly Top Doctors, and I think a lot of people are familiar with
I've
that.
heard of it. Yeah.
Yeah. So, okay. So,
Yeah.
I wasn't sure. So, Castle Connolly Top Doctors has been around for about 25, closer to 30 years at this point. And the founders, John Castle and John Connolly, created that company so that patients could be able to find top doctors. And those doctors go through a rigorous evaluation. It is peer nominated, peer reviewed. So they're nominated by their own peers. Not anybody can become a Castle Connolly top doc. And I can very proudly say that the majority, it's about 95% of our concierge doctors are also Castle Connolly top doctors. So that's something that we value, and quality matters, and they have to have an excellent reputation, and so it has to be a right fit. Maybe we're not the right partner for every physician looking to go concierge either, and that's okay. We really seek excellent physicians who want to provide exceptional care. They love the fact that we have the wellness program, and they can see us as a true partner as well in their, in
So
this new
they
model.
don't have to hire and keep on staff a health coach or a
Correct.
dietitian or anything like that. They
Right.
have those resources that are
In
shared
this
then.
partnership.
Yeah.
Exactly. Exactly. And that's huge value for them as well. Completely agree. So that they can offer these um, wellness services without having to do it all themselves.
Yeah.
And again, creating this really trusted and supportive patient approach, patient experience.
Now, I've seen models. I've talked to colleagues of mine that it's rare. I've only met one at this point, but he has a concierge acute care model. So just acute care, colds, flus, emergencies. He's an emergency room doc physician
Okay.
here in San Diego.
Nice.
Not chronic care. Most of the ones that I've seen and docs colleagues I've talked to are in are at least toying with it, are trying to invent it themselves. A lot of them I think are just trying to create their own business model.
Exactly.
Um,
DIY. Yeah.
yeah, do it
Um,
yourself, and they've got various programs, various prices, various what's the word I'm looking for, levels of access perhaps.
mhm.
So when somebody's looking at this model, we talked about how somebody, how do you vet or how do you know that a doctor is a high quality doctor or a program is a high quality program? How does somebody also determine, or what questions should they be asking in terms of evaluating the program or the levels of service, and to understand if it's a good fit for them?
From the patient perspective?
Yes. Yeah.
Yes. So you can ask, what additional services do you have? And there's still a lot of cash pay services that some of the physicians do, that can be advanced testing and diagnostic screenings. That's, something to look at from the patient side. That's from my perspective. And you can ask, on average, how long do you spend with the patients? What are their hours? How do I reach you in workday hours? What is what does that communication look like? How easy is it to reach them? Do I still get to use insurance? Price point matters for people. In uh, the market now, there is a lot of competition, of course. And so one thing we say and see is plenty of physicians think they can go out, set out and do their own concierge practice, and maybe that works for them. There's no right or wrong, John. Why would they partner with us? we have tried and true practices and processes. There's a reason our model works, and best practices matter. Lessons learned matter. If you want to do it yourself and go the hard way and learn, the school of hard knocks still applies. And anytime we try to do something new, right? So, yeah, go ahead.
Okay, so what are some of the best practices and the lessons that you've all learned and instituted to improve the patient experience? Excuse me.
I can't give away all of our secret sauce, but uh, no, in any case, well, part of it is helping that physician in that transition to in the conversion. So when they're converting their model, there's a lot of fear.
Yeah.
There are a lot of emotions that physician has, including the guilt of leaving some patients behind and a lot of fear. And am I going to make enough money to live on and things like that? So we help the physician, and then we also support the patients and those that become our members. And so it's just an intensified, a higher level of support. And it's hard to know until you're actually in it, if makes sense, right? Like we can talk about it, but until you're actually experiencing it and can
Right. But
compare.
I'm gonna push you a little bit on this point
Yeah,
because we talked
yeah,
about, best practices and lessons learned.
yeah.
So from the patient point of view, you've done this. How long has Castle Connolly done this for, first of
10
all? So
years.
10 years. In a decade. I know when I was in practice, a decade, I definitely was not doing things the same way
Right.
that I was the first year.
Yeah.
And that's where the lessons learned, the best practices, the tweaks, the innovation comes in. So what innovations have you guys worked on that, provides, allows you to provide the superior level of care that you think is different?
Mm, hugely. This is exactly my area and wheelhouse, and I'm really honored that I get to do this in my day job. Truly. It's where I get to pull in creativity and innovation and technology. And it's really exciting. It's a different world now than it was 10 years ago, John. And we see that. So, to that point, we are leveraging some very cool technologies. And not every patient wants technology in that relationship with their doctor, but it's the way the world is going. Consumers are very savvy, right? About health. And I mentioned some advanced diagnostic screenings and getting on an in-body and measuring body composition. Well, what we do is take all of that data. And so as one of our members, we are using technology and platforms where we can track it. We can see their data and follow it over time and create a plan for them. What is really actionable for them to work on? And we were talking about longevity metrics, or we've mentioned longevity and health
Yeah.
span. How do we track that? How do we know we're even making a difference?
So can you share some
This
of that? How do you know you're making?
Sure, sure. Well, first you have to test. I'm really a firm believer in testing body composition and VO2 max. Have to bring up the Peter Attias of the world, and we know this. There's so much science out there. Musculoskeletal health. All right, here, we're touching on an area that you're extremely passionate about. I had you on talking about osteoporosis, and honestly, our conversation got me even more excited about what we are doing because
Oh,
if
that's
we
great.
can, yeah, and I'm not joking, if we can prevent it, it was like a light bulb moment for me. All the best nutrition in the world is great, but if you don't pair the physical, if you don't have good balance, if you're not mobile, if you're not strong, right? And
Yeah.
supporting our musculoskeletal health as we age,
And I,
it's
I
not
love that you're
healthy.
talking about this because in the world, in there is a love, I think, and a fascination with technology, and it's important to use technology where it can add value to patients and to making clinical decisions. But frankly, I think a lot of tests that are ordered, they don't really change ultimately the approach to treatment, and I think it can be helpful for helping to motivate people and track changes over time, and that be fantastic. But really the fundamentals of health are exactly what you're talking about. Sleep. What's your quality of sleep? What's your quantity of sleep? Are you exercising, but are you exercising safely? Are you getting enough protein and other nutrients to build muscle? Are you increasing your balance? What's your stress level? Because that just is a health destroyer. And those foundational pillars of health that you mentioned are things that too often get, in my opinion, overlooked in this drive and desire to focus on the latest and greatest technology and save time having to talk to patients, because these conversations, these more subtle, nuanced conversations around those pillars of health, they too take more time than just ordering a test and reviewing a number on a test.
That's it. That's it. And that's why, back to that integration of wellness and medicine, why they
Right.
were disparate. Yeah, we
Yep.
don't know. But this is it. And it isn't complicated. The technology is cool and it's supportive and it's there for us to use in the right way. It's not the end all be all, but it helps us scale it, John. And it helps us really drive into that nuanced approach in the coaching. Yeah, go
Yeah,
ahead.
and it made me realize that you in when you said it's not complicated, it's not, and we all know that. I think every
Right.
doctor sort of knows that. But what they lack in a clinical setting often is they may not have the training to have that expertise. They may not have the time to be able to have those more nuanced conversations and coach people into healthier long-term habits. And they don't have the technological infrastructure there that would support them charting and tracking and making sure the recommendations are appropriate for those patients. And that's where a system using technology to support a system with wellness and medicine at the intersection of that, and the patient coming first, where I think that this concierge model really excels and shines above everything else.
You just once again completely summarized perfectly, beautifully, accurately, and articulately what we're doing. And that is the differentiator. And I sincerely mean that. And I don't really see it out there yet.
You haven't seen
So,
anything with your model out there either, which is one of the reasons why I
yeah,
really want to talk to you and
thank you.
understand it better.
It's exciting. I actually do have conversations too with some of our physicians where I forget that it isn't their wheelhouse. They do the complicated medical side, but for me, putting somebody on an in-body and seeing the body weight, the fat, your muscle, your fat, and your water is not complicated. And that's what we're saying. So, and that's so important not to overlook it. But guess what? I'm not exercising if I haven't slept well. And you mentioned stress. I'm sorry, I say stress can move mountains. Gave that example earlier about the blood sugar and the little changes that make a big difference. But honestly, the stress was really the biggest issue in that member's life.
That
And
is,
so I know her well enough to talk about, yeah, uh,
I,
that. So
I see that so much too. And also one of the things that I think more and more people are aware of is this chronic inflammation and how dangerous it is. Inflammaging has been coined as a term, and people that's gained in popularity. But all of those areas, sleep, exercise, nutrition, stress, when not optimized, increases inflammation, increases how fast somebody's aging, and shortens how long they're going to live, let alone have the quality of life that they want to be able to enjoy their family and grandkids and activities and travel and garden or whatever it is they love to do. Um,
yes.
so I love these foundational approaches that you're taking.
Right. Thank you. You just said something there too about the um, ultra processed food. So the quality of our diet, and it's quality over quantity. I mean, we really are trying to impact that quality of life, quality of that health span. I was uh, trying to wordsmith this a little bit with our marketing team, and we're coming up with new things. I don't know that longevity is the right word. Quality of life to me, and coming from a clinical background, it seems like an end of life thing, but health span hits, it really summarizes our health span. And but just having meaningful moments every day in our lives, focusing on that joy with the kids and grandkids. I say this to whoever cares to hear in my own personal life. My goal is not just to be an active grandparent, it's to be an active great grandparent. How
Oh,
cool
I
would
love
that be?
that. Yes.
Ah,
Aspirational.
that is aspirational. And sadly, I didn't grow up with grandparents. They all died too soon. So those are things I like to tell people. Like, what's the goal? What's the end game? It's like truly to live better. And, I get to do that and help people in this role, bring it back to what I do in my role as senior vice president at, for Castle Connolly Private Health Partners. I love saying that because let's bring the fun back, John,
Yeah,
and
that's
not
so
telling
important.
people,
That's part of
yeah,
health, though. That is
it-
such an important part of that. Hope, dreams, fun, joy. That
yeah,
something that we haven't talked about, and it's not emphasized enough in medicine. The importance of that.
it's not. And we're bringing that back. Even this discussion, I realize. So in helping people get and stay more active and building muscle, it's not yelling at them to get to the gym and build
Oh,
muscle.
yeah,
It's right.
yeah.
It's helping them discover things about themselves that they may have, put by the parked it for decades because of their career and busyness in their own lives, and helping people rediscover what they love to do. That's a
Yeah, it's so interesting you mentioned that. I remember I finished med school. We had our first child. I was building my practice, starting my supplement company, NBI. My wife had her business, and she was working. Had our second child, and those are the years where we were just grinding. And when we started to get a little more, financially stable, like a little more established, and started to have a little more time, my wife looked at me and said, "What would be fun for you to do?" And I
love that
couldn't
question.
think of, like, I had forgotten. I literally could
Fun.
not think of one thing that would be fun. I had forgotten. I was for so many years in school and working, and I think that a lot of people are in that situation, and
Mhm.
so helping them, rediscover the joy, rediscover maybe a passion, rediscover what lights them up, is an
Yeah,
important part of holistic health.
it's awesome. And it's a gift to be able to do that in your daily work for me, right? And my health coaches. And honestly, I've built a team that I think is quite happy and feels very fulfilled in what they do because that's what we're doing. We're helping others find joy, feel better, and again, who can really put some sort of price on that?
I
None of
love
us.
your approach. Absolutely love your approach. How can people learn more about your work, about your company, and explore this and see if this is a good fit for them?
Thanks, John. We are found on the web, of course, at www.ccphp.net. I'm going to say that because it's a mouthful. Castle Connolly Private Health Partner. So ccphp.net is our website. Again, I have the Sense of Wellness podcast as part of the work that I do. So that's found on wherever you listen to podcasts. And I'm Susan Greeley. I'm also out there as Food Med RDN, but I'm on LinkedIn. I'm on all those social media networks as well. But yeah, check out Castle Connolly Private Health Partners if you are a physician seeking to, have a easier way of practicing, and or if you're a patient who's just frustrated and needs a doctor that truly listens, spends time with you, and you get all these other added aspects of it. Yeah, that's us.
I love that. And those links will all be in the show notes. So check that out. Thank you for spending a little time with me. I learned a lot and I enjoyed it. It was fun. Thank you.
It's great chatting with you, John. Hope to talk again soon.
Sounds good.